number of people accused of crimes in Texas unable to stand trial as they wait in jail for mental health treatment at a state hospital has hit a new record. KXAN investigators have shared their stories with you, including how some people die while they wait, and the state is not tracking those deaths.
Late last year, the state committee charged with oversight of the wait list said it would look at collecting and analyzing some crucial data on people waiting to hopefully help drive down those numbers. Today, the committee met for the first time since our latest investigation with some bad news and some good news, along with the leadership of a new chair who tells KXAN he's seen our report and recognizes more work needs to be done. Investigator Josh Hinkle is in the newsroom with more.
Yes, and that chair is actually a longtime former sheriff out of Limestone County and the former president of the Sheriff's Association of Texas, so he's well versed in what goes on inside county jails. Right now, this is the record-setting reality. We told you in the fall when the number of people waiting in jail for a state hospital bed hit an all-time high, more than 1,800. Well, it kept going up, hitting a new high this month at more than 2,100. That state committee has put a lot of the blame on the COVID-19 pandemic, and a staffing shortage at those hospitals, we've now learned, forced many beds for potential patients offline. This week, the state announced hiring bonuses up to $5,000 for certain positions at state hospitals across Texas, hoping to attract more workers. But the committee chair acknowledges that could take time, and the need right now might warrant emergency action.
The National Guard obviously might be one of the issues that we would put on the table for consideration. I just think the problem is so huge that it's going to take everybody that's going to have to come together on our team to work together to come up with a viable solution.
When it comes to the data the committee has not been tracking on people waiting in jail, we saw some improvement at today's meeting. Race and ethnicity were added to the dashboard, though we believe the numbers are likely incorrect because, as you may remember, we discovered the places the committee's getting the data, courts and county jails, are not always collecting it accurately. But this is at least some progress, giving us a surface level look at the race and ethnicity of people on the maximum security wait list, for instance. By these numbers, Black people are waiting longer on average in jail for mental health treatment, 526 days, followed by the Hispanic or Latino population at 464 days, then those listed as white at 415 days. Knowing that makeup can help the committee understand where to better target solutions. But despite saying they would look closer this month at indigency and homelessness, two major factors experts tell us contribute to the wait list, the committee has not yet brought that up in data discussions. And we also saw no movement toward tracking the number of people dying while they wait. The chair tells us that could take lawmaker action in next year's legislative session.
As far as the tracking the data, and again, it's more paperwork for the local sheriff to have to fill out to respond to a state agency's request. It could come down as a legislative issue. It could come down as a legislative mandate.
You'll recall we discovered at least a dozen deaths in Texas' most populated counties since 2015, but those numbers are likely greater the more counties you add to the total. We will continue to track this committee and its progress in bringing down the still climbing waitlist numbers. Josh Hinkle, KXAN Investigates.
Thanks, Josh. Catch up on our team's reporting, including new interactive data features in this story. It's in the investigative section of KXAN.com.